Good evening, everyone, and welcome to another update on the pandemic that is spreading across the globe, with many countries being affected by this virus. Tonight we're going to talk about two main things. Firstly, the update on what's happening across the globe, and then secondly, prevention. Because as you all know, we have got our first 17 cases in South Africa at the moment. And in every country where there are new cases, it's very important to do the first steps, the first basics right. When you think, it's not that bad yet, I don't actually see some of it, how can you respond? What can you do to limit the spread? Remember, what's very important is not so much how many people die from the virus, because in Korea we have seen that it's 0.5, 0.6%, and it's a very low percentage because they're testing a lot of people. So the majority of people will recover in full with no side effects, and they will have immunity against the virus in future. The big risk that we are seeing at the moment is what it's doing economically to countries. It's affecting tourism, it's affecting work, it's affecting employment. Lots of people are getting put on unpaid leave. Offices are closing, buildings are closing down, and schools are closing. So imagine if you can't work or can't get an income. Let's say you're a casual worker and you don't have a contract, and now suddenly for 2 months you can't earn any money. And you need food on the table, you need to pay bills, you need to pay for your child's education. That's why this is serious, and that's why we have to prevent and slow down the spread. Remember, the medical services in a country cannot deal with tens of thousands of patients getting ill all in 1 or 2, 3 weeks. But if we can spread those illnesses over 2 or 3 months, it's easy to deal with. That's why we've got to limit the spread and really act responsible. When you feel that you're not well, you've got a fever, then stay home. That's important. Anyway, let's get to the first point and look at the numbers at the moment in the globe. This is tonight's figures, the 12th of March. Cases across the world that has been tested, 132,995 cases positive, 4,946 deaths. Recovered patients of those ones that were tested, remember there are many more that recovered but they were never tested in the beginning, 68,891, completely fine. Countries involved, 125, South Africa 17 cases across 4 provinces as far as I know at the moment. Then if we look at the clinical features, just a quick recap, we've done this before. Fever, the number one symptom, 98% of patients will get a high fever. Why? Because it's the first time you're exposed to the virus, so you're going to get a fever. And above 38 degrees is the level where you've got to be looking at your other symptoms as well to decide, do I need to go see someone or not? Coughing, 76%, difficulty in breathing, 55%. Little bit of body ache and pains, half the patients sore throat as well, maybe in the beginning. The important thing, the reason why coughing and difficulty in breathing is so high, we've discussed this before. This is a lung virus. This is not a sinus or a upper respiratory tract virus. It's a low respiratory tract virus. It prefers to go to the lung tissue. It makes it difficult to breathe because the distance between the alveoli, which is the air bubble in your lung, and the blood vessel that needs to take the oxygen into the rest of the body, that distance needs to be very small. If there's inflammation and swelling in that area, then oxygen struggles to go from the bubble, which is the lung bubble, into the blood vessel, and you can't get enough oxygen. That's why those patients struggle to breathe and why they need to be admitted. The majority of patients are not going to get that. The immune systems will kill the virus before that, so they don't need to be in hospital. So what do we do to prevent? This is really important. At your work, at your school, at your university, and at your home, make sure you have a little tray or a little table at the entrance where there's a hand cleaner, hand sanitizer, and also a thermometer. We want people to be able to check their temperatures, preferably a non-contact thermometer. What does it mean? It means a thermometer that you're not going to put into your mouth or in your ear, but you just point it to the forehead, push the button, and it will give you the temperature. Less than 37 degrees is normal. Above 37 to 38 is a mild fever, and above 38 is an active temperature that needs to be looked at. So it's great to be able to do screening before you enter the workplace. If you 10 or 20 or 30 people in a big office and no one gets checked by the entrance, and they've been sitting, at their normal desk with 10, 20 people surrounding them, and they've been coughing all day, you've exposed everybody and the office just closes down. So we don't want that, especially in schools, teachers, anyone that's ill, that have got a fever. If you have got a temperature or fever, do not go to work or to school. Stay home. See how you're going to respond. Isolate yourself for 2 days. See if it gets worse. If you start struggling with breathing and your coughing gets worse, then yes, you might have to be tested. It's also important that if you do cough, wear a mask. If you can't get a mask, which is a little bit difficult, then at least cover your mouth with a handkerchief or a tissue. Do not cough or sneeze in your hand, because you touch people with that. Cough and sneeze in your arm, your elbow, like we've also discussed before. Basic things to not spread it to other people. Okay? It's very important that when you don't feel well, to not go to your normal workplace and spread the virus, then think that you might be better. Rather stay home earlier for a day or two and see how things progress for 48 hours. That's really, really crucial. It's also important to stop or reduce smoking and vaping today, very soon, because that is another thing that is going to cause a difficulty for the oxygen to go to the blood vessel in your lung. And if you've already got that and you get the virus on top of that, your breathing might be affected in quite a severe way. So I hope this is a good summary for us to see. Remember, we've discussed previous things, previously how you can prepare. We've discussed getting enough sleep. We've discussed drinking enough water. It's important not to drink ice water or cold water, slightly warmer water, lukewarm water with a bit of lemon in, to rinse the back of the throat. Don't have a dry throat. The virus does not like higher temperatures, so it's good if you can drink the fluids, have your vitamins. And also remember, our older people, our immune compromised people, even TB patients, they are at higher risk, so don't expose them. Take extra precaution around those people so that you don't give them higher risk of getting infected. We all need to be wise. We need to not fear. Knowledge is power. That's why these updates are there. There's a lot of things available on the web and a lot of information, but remember, let's not spread fear, but be wise and make good decisions, preventing this from spreading quicker. And yes, we will get through it, and it might be a difficult time, a testing time like we've not had before, but if we work together, we can limit the spread, and the medical institutions will be able to cope with the difficult situation that lies ahead. Thank you for watching, and remember, stay healthy.